And we are live everywhere. Welcome, folks. This is Marcy Timmerman. I'm the Executive Director of Mental Health America of Kentucky. I am pleased to have you join us for Coping with the Holidays by Dr. Stephen Taylor. Dr. Taylor has been in private practice at River City Psychiatric since September 2017, where he combines medical management and psychotherapy. During this time, he completed a 2-year course in advanced psychotherapy at Cincinnati Psychoanalytical Institute and is currently a candidate in psychoanalysis at the Cincinnati Psychoanalytic Institute. Prior to River City Psychiatry, Dr. Taylor was a medical director of Peace Counseling, part of Kentucky One Health. He served as a psychopharmacologist, conducting medication management for various psychiatric conditions, performed more than 6,000 ECT treatments, and provided care for both outpatients and inpatients from Peace Hospital. Dr. Taylor also served as gratis faculty at the University of Louisville and as a member of the executive faculty. In 2013, he received a Certificate of Excellence in Teaching medical students and residents and received the University of Louisville School of Medicine's Teaching Award in 2012. Dr. Taylor was born in Kansas City, raised in Mississippi, and moved to Louisville in 1986. He is a 2002 graduate of the University of Louisville School of Medicine. Dr. Taylor has been the Chief Medical Officer at U of L Health Peace Officer since Peace Hospital, since June of 2020. Thank you so much for joining us, Dr. Taylor. Is there anything that I missed in your bio?
No, I can't think of anything. It all sounded good the way you said it, so.
I'm sure you can give some credit to Kelly for that.
That's true. Yeah, hats off to Kelly also.
Mm-hmm. My first question comes from the actual bio itself. Can you tell our audience what a chief medical officer does? I think a lot of folks don't see that person very often.
Typically, well, that's true. Oftentimes you don't. The chief medical officer is often an administrative role in a hospital or institution whose one of the chief jobs is to ensure that the patients are receiving the best medical care they can. To be a liaison between administration and treating physicians and practitioners in the hospital, as well as being a liaison for the patients themselves. Yeah, oftentimes patients won't see the chief medical officer, but the chief medical officer is pretty busy in the background watching what's happening in the hospital and making sure the patients are being cared for safely and that they're getting everything that they need.
We also have quite a few attendees from out of state who may not be as familiar with Peace Hospital. Can you kind of give some context of a little bit about the hospital?
Sure. So Peace Psychiatric Hospital is a freestanding psychiatric hospital. We treat both adults and children in the hospital. And we have a combination of inpatient psychiatric care as well as intensive outpatient programs for adults and for kids. We have a program called the Crossroads, which is an outpatient program for children. And we have several adult outpatient programs that we run as well. We also do substance abuse treatment at Peace Psychiatric Hospital, both as an inpatient treatment as well as in our intensive outpatient program.
You guys really cover the gamut. That's wonderful.
We try.
Thanks for telling me a little bit about yourself, what you do, and where you do it. That's always important to have. I've personally never seen a year where today's topic, coping during the holiday season, has been more timely for Kentuckians, and I'm sure you agree. Holidays always have such increased expectations. What types of tricks and tips do you have around managing your own and others' expectations for the holidays?
Yeah, just in a normal year, this would be a 1-hour talk just talking about coping with the stress of the holidays, subtracting away the effects of the pandemic. But certainly, taking care of yourself and making yourself a priority is important. The holidays can be very lonely. It can be very stressful to go through the holidays. And even if you're surrounded by family, it can be very stressful. And it's easy to forget that we need to find time somehow that we can take care of ourselves, whatever that is, whatever makes us feel better, or ways that are healthy, or ways for us to do that. Getting exercise, things reading a book, anything that we can do that sort of takes care of us. It's important to really spend time thinking about and spending time with those things, especially during this time of year.
It's a good tip. Folks, if you who are listening, if you want to, you can chat into our chat with some of the things that you're doing to help take care of yourself during this time, if you all are doing that. And also feel free to chat any questions along the way. We'll try to incorporate them as we go. Holidays also come with increased stress. I think you and I both know that. And some of that goes with the expectations and some of it's just because it's the holidays, right? A lot of new things are going on. We know that stress impacts our physical health in many ways. It's important to learn to manage it. Do you have any go-to stress relief ideas for folks?
I like to walk. So walking is the thing I do. That's sort of my go-to thing. Even if it's cold, I'll just bundle up and go find a trail somewhere and walk. So that's the thing for me. I have a really good friend whose stress is bubble baths. So that's where they go, and that's great. And so, I think it is something that's sort of different for all of us, to be sure. And I like spending time with friends when I can, and this pandemic makes it stressful for us to do that. But platforms like this, Zoom, while this is not perfect, it certainly does give us a way that we can connect with each other. The FaceTime, doing FaceTime calls or other ways of communicating that way are good to stay connected and to remind us that we're not by ourselves, we're not alone. Those things are important to use as well. And I have a friend too, another friend who is such an extrovert. This pandemic is making him crazy with all the social distancing. But he has this enormous front porch on his house. It's an outdoor porch. And he's got it set up so that on one end of the porch, he's got himself sitting with a computer screen and a long cable that goes to a monitor at the other end of the porch. And we'll sit out on his porch and watch movies. So he'll be, we're outdoors, we're socially distanced. He'll be at one end running his computer. I'll be at the other end with a monitor in front of me, and we have movie time that way. And so, that's a way that we can sort of get together and spend time together in this crazy pandemic time.
That's a really creative solution. I approve. I'm going to have to think about something like that for myself because I'm obviously an extrovert. What are some signs of stress though? Like, I don't think that everyone realizes when stress is present, especially now in COVID-19, where kind of stress is every day. Do you have some like general tip-offs that it's maybe time to do some self-care for folks?
Yeah, I mean, if you're not sleeping very well, that can be an indication that you are under increased stress. Feeling tired, more tired than usual, that's a pretty fair indicator that we are suffering from stress. I was having a conversation with somebody recently about this experience of interacting virtually. And they were talking about how exhausted they were back in March and April. They were doing the same amount of work, but they were doing it all remotely. So they were talking on these Zoom calls. They were talking on other, sort of social media platforms. And they were just wiped out at the end of the day, because it takes a lot more energy. It takes a lot more of our concentration and energy to connect and feel connected through this kind of medium. And that's definitely a sign of stress. That's feeling exhausted from our work is one of the ways that we definitely feel stress.
That's a good tip off. I found my frustration tolerance to be a little lower lately. And so I'm like, when it gets even lower, that's also a tip off for me that it's time for some self-care and taking a break.
I was looking at the chat here, and I just saw somebody put in a chat that just kind of caught my attention because it's about food. It looks like what one of the viewers said they bake cookies, 6 or 8 different kinds of cookies every year, and freeze them and enjoy them during the morning. I need to know where this person lives.
She's in Licking County, Ohio. She's one of our MHAs there, actually. Thanks, Penny, for sharing that. That's great.
Yeah, I need those cookies.
I'm a cookie baker as well. I'm going to be stress baking for the rest of the day, probably. So that is something that I've seen a lot of, actually, is a lot of baking happening too across the country. So that's been really interesting. Are there anything specific that you can think of that we can do to help children manage holiday stress? I know the holidays are so magical for a lot of kids, but also during COVID especially, we're seeing more stress out of kids. So is there anything you can suggest?
It is very stressful for them. You know, kind of the same things we're talking about for us are things that I would sort of reflect for kids as well. Spending time with them, playing, you know, having fun, playing games, um, helping them sort of engage creatively and to have fun is important too. It's a great way to relieve stress also for kids. You know, the cookie thing, that if you know, that would work for me if I was a kid. So, you know, getting them involved with doing things around the house, getting them involved with baking if they're old enough, those things, kids like to do that. Some kids do anyway. And that can be a real stress reliever too, getting them more engaged with the things that you're doing.
It's a great idea. I've found myself cooped up at home with my first grader and my husband. And it's like sometimes we're all in the same room and yet completely different places doing very different things. So that connection has become important. Mm-hmm.
My wife's mother had this amazing ability to engage children. You know, she would put them at a table and then she would plop something in front of them to do. You know, a puzzle, something to play with, leftover dough from a pie crust or something, and they would just play for hours. You could just give them something to do, and they would just be completely entertained. I've never seen anybody with that kind of gift, but she really was gifted at that.
Sometimes it takes an extra special creativity to do that kind of thing. It's a good idea
That's
though.
right. Yeah, yeah.
So we'll switch gears just a little bit. It's common to have many traditions around the holidays, of course, from menorahs to Christmas trees, to candles to food. Traditions vary a lot in what they require of both time and funds, but are there mental health traditions we should consider adding to our festivities?
I think that's a really important thing to consider. Yeah, you know, things that we do that are good for our mental health. Um, Not keeping our, I sort of think about the knots. I'm going to say the knots first. You know, like we should not spend all of our time with our nose buried in the news. You know, that's just going to make us depressed. We do need to take time to engage our minds in other activities. Um, Reading, watching movies, playing. Somebody talked about bringing out the old vintage board games. You know, playing games, things that sort of engage our minds in ways that sort of can be distracting. Which I think a little bit of distraction can be a good thing. We don't want to be totally distracted, but we don't want to be so wrapped up in what's going on that it's just we can't disengage from it. I think that's one of the things that we can really do that's very crucial. Making sure that we're getting enough rest and we're sleeping. I mean, that's something we don't talk about a lot. We don't live in a society that spends much time talking about sleeping, but we do need to make sure we're getting enough good sleep and eating healthy. You know, taking care of our bodies too is a way we take care of our minds. That's also important.
And I'm going to selfishly plug our mental health screenings as something that you can definitely do anytime during the holidays, folks, especially if you're concerned about your drug or alcohol use, or if you're concerned about whether what you're feeling is normal, because it's definitely a time that brings up a lot of those conflicting and sad feelings. So that's something that we would say as well. But I love your ideas of, you know, getting enough sleep being an actual tradition of the holidays. That's an important thing.
Yeah, making sleep a holiday tradition. That should be like that should put that on my door.
That should totally be a meme. We're going to have to make it one. Penny added in the chat as well that anything people can do to help someone else in need is a great stress reliever. She finds that, you know, having kids help with cooking for a holiday meal or buying gifts for the Salvation Army or the Angel Trees or whatever. That's a good idea too.
Yeah, I like that idea too, because it also starts building habits like that early on.
Mm-hmm.
You know, getting kids involved in that, it sort of becomes a kind of sort of builds into their own fabric. So as they grow and get older, they just sort of do it. That's the kind of thing that they just kind of do.
Yeah, that's a good point. So I've heard many moms and others saying that the holidays just aren't as fun this year. They're not as festive as they have been in years past. Um, Whether it's due to changes in their economic status, maybe someone was laid off, maybe both of them were having lost loved ones, of course. We know that that's front and center right now, or having to drastically change their usual plans. Just changing our normal life, right, can be really stressful and sad.
Mhm.
Do you have any tips for handling feelings that are less than ideal or different than usual?
Well, I think that one of the most important things we can do with our feelings is just to acknowledge that they are there, and to allow ourselves to feel the things that we feel. I think part of the pressure about the holidays specifically is, all of our songs are about, it's the most happy time of the year. All these things are telling us that we're supposed to be excited and happy. And those things are there, they're true. But there are other feelings that we have too. And I think that, when folks are feeling the feeling of loss, they've lost a loved one, they're feeling the intense loneliness of being isolated, all of those things that they feel are feelings, and they are feeling them. And I think to fail to acknowledge them runs the risk of making things worse. If we just try to say, no, I can't feel that way, I have to be positive and happy, then I think that we can sort of back ourselves into a corner. So I do think that acknowledging what we feel and just being able to feel what we feel and having a way that we can talk about it, I think is important. Having a counselor, a friend, or a confidant, or somebody that you can talk to about what you're going through. Support groups are very helpful in helping people deal with feelings that are causing them psychological pain. I almost caught myself saying negative feelings, but I think that probably sells them short. Because if somebody's grieving, it's not that grief is a negative feeling, it's just that it's something that's hurtful, and it's something that we also have to process and to deal with. So having a way we can talk about it, or somebody that we can talk about it with, is important for our mental health.
Mm-hmm. I've seen a lot of people seeming to identify how they feel as being who they are. Is that common, do you think, or is that something that's healthy or not healthy?
Can you say more? Tell me
They
what you
tend
mean.
to be like, I'm now a sad person because I'm sad today, or they identify with their feeling, like self-identity. I didn't know if you've seen a lot of that happening, if that's a healthy behavior. I'm guessing it's probably not.
No, I do see it a lot, and I'm just kind of thinking about it as you asked the question. I guess because I'm sort of thinking about what I think about that. Yeah, because I think you're right. I think we do tend to identify ourselves with our feelings. So, it's kind of like the Winnie the Pooh story, right? We identify Eeyore with sadness. We just say Eeyore is sad and mopey. We don't say Eeyore feels sad and mopey. We say Eeyore is. So we kind of do tend to identify ourselves with feelings in that way. And so we may be selling ourselves a little short when we do that. Yeah, I may be feeling sad today. That may be one of the things that I feel. But that doesn't necessarily mean that I am a sad person. It just means that today I'm feeling sad. So I do think that, I think in mental health, this seems to be a thing more in mental health, is from what I see, than in a lot of other areas of kind of the medical world. Although I think that maybe people who have some particular chronic health issues will identify themselves with those chronic health issues. But, if I have high blood pressure, I don't walk around saying I am high blood pressure. It's like, it's not something that sort of is what I am. It's one of the things that my body has that I'm dealing with. So I think that is kind of true about our feeling states. But I think sometimes the opposite thing can be true as well, where people won't identify any of their feelings and they're really disconnected from them. And that can be a different kind of problem. So, there is something kind of healthy about being able to be aware of what you might be feeling and acknowledging that you have it. But I do think that the over-identification with it could lock out other things that you might be feeling too.
Thanks. That was an excellent answer. And I know I surprised you with that question. So thank you very much on that. Are there some common signs or symptoms that indicate that normal holiday stress isn't the only thing at play, like that there might be something more serious going on?
Yeah, well, I think the obvious answer to that today, as we're talking, is we're in a pandemic, so that's there. But in some ways, those kinds of stressors are happening even outside of the typical holiday stress time. What could be signs that somebody may be suffering from more than just the holiday blues? I think one way to answer that question would be, how long have they been suffering? We sort of think about the holiday blues sort of coming on with when the department stores start blaring Christmas music at us. And when we see the first reindeer go up in front of somebody's store, that seems to be kind of the heralding the holiday season, which can be bringing those feelings on. But certainly if those feelings are happening before that ever starts, there's something there that could tell us there's something that's been going on for a while. And if we see somebody having, really severe difficulty in functioning, they aren't sleeping at all, they stop eating, they can't seem to get themselves even to get up and get ready for work, or grooming habits just disappear, they quit showering, they stop taking care of themselves, those would be probably signs that something more is going on. There's something else happening here. And especially if somebody becomes suicidal and thinks that they just can't live anymore and they're starting to plan how they might take their own lives, that's certainly a big warning sign that maybe something else is going on. It's not just about the holidays.
It's a good one. Thank you. I know that seasonal affective disorder gets kind of thrown into holiday blues a lot for folks. Can you kind of differentiate between those two? Like what might be, since they happen almost the same time?
Right. They do happen at almost the same time, but the days stay shorter longer than just in the holiday season. And it's interesting that you're asking the question, because I was thinking about this as I was driving over here to my office about seasonal affective disorder and what I thought about it. And I think maybe I was thinking about it because here it's a gray day, it's cloudy and I'm not seeing the sun, and it looks a little bit like it's all kind of just that time of day just before sunset, when the light starts dropping off and you can't see shadows anymore. And I was thinking about that, the quality of light in this time of year. And certainly the further north you get, the more likely you are to have issues with seasonal affective disorder. I doubt it's as much of a problem in Miami Beach as it is, in say, northern Maine or in upper Minnesota or something, where you get really far north and the days really get short. And certainly not like it would be in Alaska, where I think this time of year, they're almost dark 24/7 now for the next few weeks. And so, so I think seasonal affective disorder is definitely a big factor. It is a real thing. And I think a lot of people suffer from it. I just can't say, kind of on a personal note, that I like dark. I like the darker days, but I'm married to a woman who does not like that at all. And whenever I go to these psychiatric conferences, there'll always be like some big arena in the conference center where all the makers of things will have their little kiosks and areas. And there's always somebody who sells light boxes who's got an area set up. And if I ever got sort of disconnected from her at the conference and wanted to find her, that would be the first place I'd go look, because she loves those things. And I think for a lot of people, light boxes are a great way to deal with seasonal affective disorder. If you are a person who suffers from more depressive symptoms during this time of year, having one of those light boxes sitting on your desk while you're doing your work is a really effective way of dealing with that.
I have to agree. Some friends of mine have SAD and they're different people when they have their light box. It's been amazing.
Yeah. Right. I'm not trying to sell light boxes, but I do think they work.
They do. And they're relatively an inexpensive way to handle it, really, in a lot of ways, and not necessarily a pharmaceutical way, which I know a lot of people reject drugs, and that's fair,
Right.
especially for something transient like that. So as long as they're not too far along.
Well, since we are on the topic of light boxes, I will just say one thing about them. There was one really good study that was done looking at light boxes and how they work effectively. And the study would have the participants extend their day by 2 hours. So you would extend your daylight by a period of about 2 hours every day. If you're one of those real early birds that gets up 2 hours before the sun comes up, you would sit in front of your computer working and have the light box so that it's shining on your retina somewhere in your peripheral vision for a couple of hours before sunrise. Or if, like most of the rest of us, you're working a kind of like a normal day, then as the sun's going down, you would turn it on and have it on for a couple of hours towards the end of the day. And that was a study that showed them to be the most effective if you used them that way.
That's really neat. I haven't seen that study, so that's great.
Yeah, it's old. It goes back to my residency, so that means it's really old.
That's all right. I just haven't looked at it recently. That's good. Yeah. To shift gears to kind of more your administrator edge of what you do, are you seeing or do you anticipate any increases in mental health crises during the holiday season, especially given the pandemic?
Well, yeah, it's interesting. The pandemic itself, as bad as things are, does not seem like it's had a massive impact on the mental health care world. But there are a lot of reasons I suspect why that's true. But it is stressful, and depression rates are higher. People who are suffering from depression are suffering more. And I think the pandemic is one of the reasons why. And my patients who suffer from anxiety are suffering from it more. And I suspect that the pandemic is part of why their anxiety is worse. So we do certainly see an increase in all that. And I would also say too, that, from a psychological standpoint, where we are right now in the pandemic and what we're hearing in the news is going to be one of the periods that will test us even more than we've been tested up to this point. And the reason why I say that is it's a little bit like we are the survivors of a cruise liner crash, and we've all somehow figured out some way to float in the ocean and not drown. And we've been doing that for 8 months. And then all of a sudden we start seeing rescue planes flying over because we've heard about the vaccine that's coming out soon. And so we're starting to see rescuers now. And so there's other activity happening. And this is a time where we would be tempted to let go of whatever it is we've been floating on and try to swim towards whatever it is we think we see coming to us. And that's when I think we're at the greatest risk. And I think we're in that period now where we really have to be more focused on continuing to do what we've been doing to keep ourselves safe. It's going to be stressful, and it's going to be trying on our capacity to be patient and to wait. It's going to make our anxiety and depression feel worse. This is a time I think I'm most watchful for my patients to make sure that, we're doing everything we can do now to make sure we're keeping them safe. The things that we've been doing already up to this point, but we just need to sort of double down and really hunker down and hold on to it.
I would say this is the time to check on those folks that are feeling okay up until this point too, right?
I think so too.
Folks that are handling it better. Yeah.
I think that's exactly right. Yeah.
Yeah. Whether they have a mental illness or not. I've definitely seen an increase in the alcohol sales and things like that as a concern as well. Is that something that concerns you in the long run?
It does, but also I'm thinking, that's probably a shifting from one place to the other. When the bars are open, they're going to go to the bars. When the bars are closed, they're going to go to the liquor stores. So I think in some ways I'm seeing a kind of a shift from one to the other in a lot of that. I think a lot of that buying behavior is related to that. But certainly the use of alcohol on top of anxiety, depression, or other psychiatric problems, mental illness, can be a very dangerous combination.
It's a good point. And I kind of thought that too when the first initial thing started happening in March. I was like, well, that's because everybody doesn't have stuff at home. And then I was like, I expected it to kind of die off a little, and then it didn't quite as much as I had expected. So that was
exactly. I've emptied the grocery store of toilet paper, and I got all the toilet paper and paper towels. Now I'm going to the liquor store.
Now it's time for
I think that's part. Right.
Yep. And that mom wine the meme happening, right? So that's always a thing. Unfortunately.
Right.
Thank you for all of this excellent information so far. Members of the audience, do you have any questions? Please go ahead and feel free to put some in the chat. I hope you got news that most of our folks that are signed up are actually seem to be healthcare workers. I didn't know if there's any specific kind of advice you have for healthcare workers dealing with these times on top of the holidays, on top of the usual winter rushes through nursing homes, hospitals.
Yeah, I was getting distracted by Kelly's question. Kelly Galuli had asked a question about, concerns about the aftermath.
Oh,
So I want to talk about her question too. But yes, your question about the healthcare workers. Yeah, absolutely. I think it's important for us to realize that we are human beings, that we all have feelings, and that we all can be hurt, and we all need help. And I think healthcare professionals, doctors particularly, are really bad at admitting that they're human beings who need help. So I would say to my colleagues and to all people who are working in the healthcare world, to take care of yourself too, and reach out to people who you trust, who can help you, to help you, so that you don't do this by yourself. You're not alone. We work better in groups. So find your team and rely on them.
yeah, it's a good one. Thank you. And yeah, the aftermath 2021, 2022. I was definitely going to ask that too. So thanks, Kelly.
Yeah. Well, yeah. I mean, I think that the thing about the sort of the recovery phase of our psychological response to disaster can be very challenging because, it's a little bit like walking out of the house the day after the hurricane. You somehow you survived the hurricane. And so there is a little bit of that feeling of elation there, but your neighborhood is completely wrecked. Everything is completely destroyed, and there's all this work that has to happen. And so I think as we, roll up our sleeves and get to that part of the process of really getting into the work, I think we do have to be very, again, as a psychiatrist, I think, to be very mindful of our mental health as we work through that. Not to say, okay, we got that out of the way. Now we're done. Let's move on. I think that would be a mistake to take that way of thinking about it. There is going to be traumatic stress to deal with. There is going to be trauma all across the board in a lot of different ways because of the effects of the pandemic. And just because the pandemic ends, which it will, but just because it does come to an end, doesn't mean that we can just stop worrying about our own mental health.
That's a good point. Yeah, we've got another question. Are there specific challenges kids will face when they go back to face-to-face school if they've been out of the face-to-face classroom for about a year?
Yeah, I was thinking about, I was just thinking about what it would be like, or what it is going to be like, to go into a restaurant for the first time, after all this is over. And I think that there is going to be a little bit of a warm-up period. I don't think it's going to be just like, oh, yeah, it's all over, let's get right back to normal, because it's going to feel different. The way we feel getting back to what we would call normal it's just not going to feel the same. And that's okay, because we've had a different experience. So it's not going to feel the same when we go back. It might have been one of Ralph Waldo Emerson's quotes, that he could never cross the same stream twice. I don't know if I'm attributing that to Emerson or if it was a Thoreau quote, but anyway, it was one of those writers that was saying, you can never cross the same stream again. The person you were when you crossed it the first time is not the person who's going to cross it the second time. And this pandemic has changed us all. We're all different. And so when kids go back to school face to face, when this is all over, they've changed. They're different. This has had a changing effect on them. And I think it's just important to be mindful of that. They're going to feel it. They're going to experience it differently, and be open to how they talk about it. What do they say about their experience? What's it like for them to go back to school? What's it like for them to see their friends again? They're going to have feelings about it, and they're probably not going to be what I imagine they're going to feel or what I expect them to feel. But if I can ask them, they can tell me what it is they're experiencing, and then I can go with that. I can work with them with what they're telling me. And I think that's important as our kids get back to going to school again, to be open to what their experience is and hear where they are, hear what they're going through, and try to meet them there.
Yeah, I've been talking to a few educators who are like, and we have to remember the kid we knew last year wasn't the same one, right? And
That's
even
right.
when folks were back in August, right? A different kid came in the door from February to August.
Yeah, absolutely.
Yeah, and I think that's an important thing to keep track of in their minds too, because they've changed too as teachers, even how they choose to teach
Right.
and what they teach has changed. So yeah, it's just going to be different for all of us. You're right. I definitely have some friends who are going to keep wearing masks after this during flu season. And I was like, yeah,
Yeah,
that'll last for maybe a year or two, probably, right? But it's actually
right.
good. They're healthier. They're like, I don't have
Sure.
the cold.
Yeah, we are going to see that too.
Hmm.
I was looking at this chat here. Um,
Oh, that's a good point,
Penny
Penny.
was, yeah.
She writes that
Um,
24/7 news is for our convenience, not our consumption. I really approve of that. So
I like that too. That's a great quote.
I may have to steal
Um,
that one.
yeah,
I'll
I
quote
know.
Lori Chris though. Yeah, she says
Right.
the hardest thing she's seeing in the community is the universal continual trauma. And that's a great way of putting it as well. Any tips for kind of holding space for that trauma as we move forward?
Well, I was just the idea of trauma just sort of sparked this thought for me. The thing I just had this flash of a thought. You guys remember the Chilean miners that were in the mine for like 90 days or something? It was just an incredible ordeal that they all went through. When they were recovered from that mine, all but one of them started showing signs of PTSD. It was almost 100%, which is not unremarkable, but I think it's worth noting because it was about time. And it was about time and exposure to trauma. The longer we are exposed to trauma, the more likely we are to have effects of trauma persist after the traumatic event ends. It's as true in wartime as it is in any other experience we have as human beings where we are experiencing trauma. And so I think that's a really good point. I think it's an important thing for us to continue to think about, that as we move forward in time, we are going to be seeing some of those signs persist, and we may see signs of it emerging where we don't see it right now. So yeah, I do think that's an important thing for us to keep, on our radar screens.
It's a good point. Yeah, I think we'll all be dealing with a little bit. You're right. So just as a community, and how does the community work through that? Well, how have we done it
Mm-hmm.
before, right? Is
Mm-hmm.
a good question to ask
Right.
ourselves. I think a lot of folks don't think about it that way. And I'm like, well, the pandemic, think about how you come together after a tornado or a hurricane or wherever you are. And that's a piece of what we're gonna do when this is finally over, right?
I think that's exactly right. Yeah.
Mhm. So no other questions are coming in yet. So I have one about telehealth. Question for
Okay.
you on how you feel it's going and if you expect to continue to see that happening after the COVID-19 pandemic ends, because I know a lot of things were waived, a lot of things have come to change it and make it a lot more accessible.
Right. Well, I think that telemedicine is probably here to stay. I think this pandemic is having a massive effect on how providers practice their fields of medicine. And so I think that those effects will very likely be permanent to some extent. I'm thinking about my own practice. I see a lot of my patients I either talk to on the phone or I see through some, kind of virtual media platform like this. And and I won't stop using it. That will always be there, even after the pandemic comes to a close. So I'll probably have patients who will continue to use one of those forms of reaching out to me. Um, it's a matter of convenience for a lot, but for some, it's just become a kind of a new way of thinking and acting and interacting. So I think it probably will not go away. I think that it does provide challenges. It is more difficult to communicate and to connect through this virtual wallpaper. But it can happen. It works, and you can get it done. And so I think as we adjust to that level of work and the kind of focus and concentration it calls for, I think it's just going to become part of how we work. And so I don't think it's going to go anywhere.
I think you're right. We're definitely pushing to keep some of the relaxed rules about it going, especially for our rural folks that would have to travel 2 or 3 hours one way to an appointment. This has really seemed to reduce our missed appointments and things. So
Yeah, there was a question here about whether insurance would continue to pay for Zoom sessions or not. Well, I really can't speak to that because my private practice, I don't take insurance, so I don't know what they're doing. But I would imagine it would be hard for me to imagine that they would stop doing that. I'm not saying that they wouldn't, but I haven't heard anything one way or the other on that question.
mhm. Jan, can you let us know what state you're in? Because I'm not sure if you're local or not, and that will make a difference as well. In the state of Kentucky right now, we have not seen any increase in complaints about that happening. So I think here the laws might differ from state to state. I would definitely, oh, I see you're in New York. Yeah, I would definitely check with your New York MHA. They'd be on top of that and know that really well. That's some of the things that group especially does really well. And locally here in Kentucky, all of them are supposed to be covering all ways at the moment still. That is still part of our emergency order. And until the pandemic is over, that will continue. And then I think there will be a fight to be had over what will happen after the pandemic, as far as what level of privacy we need and that kind of thing from devices. So, but right now they're supposed to be covering FaceTime and all of that stuff as far as I know. If there are Kentuckians on who are having issues with that, please feel free to reach out. We're at 859-684-7778. I'm always happy to, advocate for you with your insurance and all of that. So that's definitely something that I'm ready to do anytime. So Daisy comments that some providers are delving more into their laptops instead of hands-on before the pandemic. So she's worried that they're going to do more telehealth just because it's something that providers are choosing. Is that something you're seeing a lot of the providers at Peace, especially, or other colleagues of yours doing?
Well, I think that the chronological age of the provider is going to have some impact on adaptability. And so I would say that for most of our physicians who are practicing at Peace Hospital are older and not as likely to utilize telemedicine as others. But we do have a provider who's been completely on telemedicine the entire pandemic. So it's kind of it's a little bit of both, really.
Yeah, I see it as a time of transition between different generations, and there are younger members who don't like it either. I mean, that's not it's not classically the same along the ages. But,
True, that
but
is
it
true.
can. It generally, I think you're right. It tends to be who's comfortable with technology and who's not, and who's used to building rapport over virtual platforms and who's not. So I think that's something that some younger folks tend to be more inclined to have done before. So yeah. Any other questions, folks? We are getting close to time, so thank you so much for all of your time with us, Dr. Taylor.
I was happy to.
Yeah, it was some great information, I know for sure. And folks, if you're not familiar with MHA Kentucky, we are trying to do these Zooms at least a couple of Mondays a month, and they're always going to be free. Our next one is coming up next week, actually, on labyrinths and mental health with Reverend Dr. Jan Cottrell. So feel free to join us there. You can find all the information at mhaky.org. So, and anybody else have any other lasting questions? You can unmute too if that's easier, folks. Just want to make sure you get your time. Seeing and hearing none, I think we will wrap up. Thank you again so much, Dr. Taylor.
It was my pleasure. Thank you for having me.